So approach to falls. And we're going to keep, the approach to falls very simple because there are some critical things we need to know so far as this board exam is concerned. And that is why I'm excited that we go through it. Someone may say, falls, come on, what is it? But it's a major MCCQE1 objective. In fact, if I should stop sharing and then take you to the MCCQE1 objective, you realize that it's a whole topic that you need to review. Very, very important topic that you need to review. So I'm just going to share so that you understand why it's so important that we go through it today. So if you go to the MCC objectives, and then one thing I've seen is that they've changed the outlook. Okay. So let me use this opportunity to show you. So if you go to google.com, okay, you go to google.com and then you go to how to find it, MCCQE1 objectives. Just type MCCQE1 objectives, okay? When you do that, it will bring you here. Click on MCCQE1 objective. How are you going to find this specific objective? How are you going to find this specific objective? You come down here. You come down here and then look for medical expert, okay? Medical expert, because that's where the objectives for the exam is. Medical expert. You just click on it. Initially, it was the background was orange or peach or something, but they've changed it, okay? So you go to medical expert, and when you go to medical expert, you realize that all the objectives are here. All of them are here. So why are we doing this? Important objective, approach to falls. Now, you realize that we'll cover everything. And so we've broken everything down. So if you go like, I thought that falls is just a simple thing. No, it's a very detailed objective, which needs to be reviewed. And you can only say that you are prepared for the exam if you've reviewed every part of this step by step. And that's exactly what we are going to do. So please, buckle up. Let's get into this. And then let's get the game going, okay? So approach to falls. So you realize that everything we are treating in our webinars are things which are necessary and which are critical for you to know for your exam. So approach to falls. Let's go. The first thing you have to know with every MCCQE1 objective is the rationale. Every MCCQE1 objective, you've got to know the rationale. Because if you don't understand the rationale, you are going to be in trouble. And the rationale for this is that falls are common. Whenever they start anything with that, I always tell candidates, please pay attention. And I say this, common things are common. Common things are common. CTAC. Common things are common. So you realize that in the MCCQE1 exam, you are being tested on common things, okay? So falls are common and have possible contributing factors. So when they start dropping these things, if I were you preparing for the exam, what I'm going to do is ask myself, okay, if falls are common and they are specific contributing factors, then I need to know that, okay? And they can be associated with serious injury. Multifactorial interventions can prevent falls and their consequences or their sequelae. Okay, so the key objective then is giving a patient who is at risk of falls. You see, they are using that language, risk of fall. So if I'm learning for this, I'll ask myself, hey, what are the risk factors for falls? The candidate will identify contributing factors and initiate an appropriate management and prevention. So in your learning, that's something you want to really, really pay attention to. What are the contributing factors? What are the management steps? And how am I going to prevent falls? Okay, so then you go to the enabling objective. It says that giving a patient at risk of fall, again, they're using that risk. The candidate will then, number one, listen, interpret critical clinical findings, including those based on a description of recent and previous falls. 2, medical history for risk factors, like medical conditions, medication history, substance use disorder. Number 3, environmental hazards. Number 4, a complete physical and functional evaluation. So let's get into it. So we're going to start the first part, falls history. And I have a question here. I want somebody to take it for us so that we can use this question to discuss this very important objective. I have this very important question. Who wants to volunteer and read this case for us?
A 78-year-old female in the local nursing home in northern Alberta is brought to the ER with a history of fall 2 hours ago. She's conscious and alert. What would you like to know on history? History.
Beautiful. So the first objective says that we have to know from historical features. So type your answers for me. What would you like to know on a history of somebody who comes to the hospital or who is brought to your clinic with a history of recurrent falls? What would you like to know? Let me know what you think. What would you like to know? Vision. Dr. Cosmos, that's not clear. Okay. Previous falls. Beautiful, Dr. Rahman. And you will understand why I'm saying previous fall is wonderful. Dr. Mohammed says lucid interval, adequate lightning, previous fall. Beautiful, Dr. Biola. Beautiful. Dr. Omar says vision, DM, medications, previous history of fall. Good. Balance problems. Dr. Shimon is using the SPLAT acronym. Syndrome during falls, previous falls, location at the time of fall, activity during falls, time of falls, trauma. Okay, awesome. So those on Facebook as well, please put in your comments. Let's see. So when you have a patient who has had a history of falls, the first thing you want to know is history of previous falls. Has this patient had any previous falls before? Okay. Number 2, what is the activity at the time of fall? What was the patient doing when the patient fell? Any prodromal symptoms before the fall? So that's something very critical you want to know. Did the patient have any symptoms, anything? Did the patient complain of any lightheadedness, any imbalance, any dizziness before the fall? Please note these questions very carefully, because if you have a patient with fall, do you want to find out about these? Where did the fall occur? Was it in the bathroom? Was it in the sitting room? Was the place carpeted, and even with the carpet, is it woolen carpet or not? When did the fall occur? But you realize that in this particular case scenario, we've already provided, we said 2 hours ago. Okay, was there any loss of consciousness? Does the patient have any underlying chronic disease? Does the patient take any medications? I saw some candidates writing that. What's the time of administration of these medications? And then history of alcohol use and environmental history. So you want to find out all these things about a patient who has a history of falls so that it can guide you to know how best you can evaluate this patient. So please note this very well. When it comes to a patient with a history of falls, you want to know all these things in detail. Okay, good. Now, please, the doctor who read it for us, can you please take this one as well for us?
Okay, a 78-year-old female in the local nursing home. Is the same question? Okay, a 78-year-old female in the local nursing home in northern Alberta is brought to the ER with a history of fall 2 hours ago. She's conscious and alert. What would you like to know on history about specific medical conditions that may have contributed to the fall? History.
Beautiful. So you realize that it's the same preamble, and at times in a CDM, that's what you should expect, right? The same preamble, and then questions may come underneath. So that's what I'm giving you. In our history of falls, we said that we want to know about some past medical history. But then the question is, what's past medical history usually contributes to patients having falls? Anyone? You can type your answer. Let's go. No,
diabetes.
Please type your answers. Yeah. Please type them, because in the exam you'll be typing them, right? So Dr. Simran says diabetes, hypertension, cardiac problems, arthritis, orthostatic hypotension. Dr. Sial, Dr. Maria says history of epilepsy, hypotension. Dr. Shumara says chronic hypertension, diabetes mellitus, history of seizures. So, according to the textbook, what are the medicate the conditions a patient should have, or a patient, what are the conditions which predispose a patient to risk of falls? Number one, Parkinson's disease. Remember that Parkinson's disease, at times they have this shuffling gait, you know, the way they walk. Yeah. So Parkinson's disease, chronic musculoskeletal pain. And you come to understand why I'm also saying that. Knee osteoarthritis. If the knee is not able to hold things well, that's a problem. Cognitive impairment in the patient. Okay. Dementia, stroke. And then I saw a lot of candidates also writing diabetes. Beautiful, beautiful, beautiful. Diabetes. And then visual impairment. So, you know, we have all the risk factors for risk of fall, but these are the top risk factors. So if you want to learn them, I'll say, you know, at least make sure that you've memorized about 4 or 5. Make sure you've memorized about 4 or 5 of those risk factors. That will help you to know that these are the risk factors for falls, and this is how I'm going to go around them. All right. So that same patient, 78-year-old female, in the local nursing home in Northern Alberta, is brought to the ER with a history of falls. 2 hours ago, she's conscious and alert currently. You are, however, informed by the nursing home staff that she had lost consciousness prior to and after the fall, but currently she's conscious. Which specific systems would you be concerned about? So if you have a patient, so this is something very critical. Fall in a patient who was unconscious before the fall, which areas would you want to focus on? Doctors, you see the way we are going, we looked at general history for falls. Then after that, we went to medical conditions which are specific that you want to know about. Now, we are looking at a patient who had a fall, but prior to the fall, the patient lost consciousness, or right after the fall, the patient had loss of consciousness. Which medical conditions are usually implicated? Let me see what CNS, CVS, neurological endocrine, Dr. Ma, CNS endo, CNS musculoskeletal, heart arrhythmia. So that is cardiovascular, right, Dr. Heiser? So if you have a patient with fall with loss of consciousness, let me say it again, loss of consciousness plus fall, which people are you thinking about? Think about patients who have issues with their blood pressure, orthostatic hypotension. That's number one. Fall plus loss of consciousness. Think about patients who have issues with orthostatic hypotension. Number 2, patients who have cardiac disease. Number 3, patients who have neurological disease. Patients who have issues with their blood pressure, hypotension, orthostatic hypotension. Blood pressure is usually normal when they are lying down. When they stand up, blood pressure drops. Cardiac disease patients and neurological disease. Doctors, can I proceed? I want us to really pick up all the major objectives and the enabling objectives and then make sure that we've dealt with them one by one. So I don't want us to rush through anything. I want us to take our time to go through it. Okay, good. We can move on then. So loss of consciousness plus fall. Which conditions am I thinking about? Orthostatic hypotension, cardiac disease, and neurological disease. These 3 things. Good. This is an MCQ question. A 78-year-old female in the local nursing home in Northern Alberta is brought to the ER with a history of fall 2 hours ago. She's conscious and alert currently. The question should be, what's the most important consideration? Let me share my screen again and let me correct it. What's the most important consideration on history? A, previous history of fall. B, activity at the time of fall. C, any prodromal symptoms before the fall. D, location of the fall. E, loss of consciousness. What's the most important consideration on history in a patient who has had a fall? We have Dr. Bimbola going with A. Beautiful. Dr. Ma going with A. Beautiful. When I start saying beautiful, 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 you realize that probably that is the answer, right? Up to date will tell you that the most important consideration on history of an elderly person who has had a fall, the most important consideration is a history of previous fall. So up to date, that's why I quoted up to date directly, because up to date is one of the key resources you need for your exam preparation. It says the most important consideration in the history is a previous fall. That's it, game over. So yes, activity at the time of fall is important. Any prodromal symptoms before the fall is important. Location of the fall is important. Loss of consciousness is important. But the most important consideration is a history of previous fall. Doctors, are you following me? Are you following me? We are building up gradually. Are you following me? And can I proceed? Beautiful. Okay, let's go. So our Zoom is full. So if anyone wants to join and contacts you, kindly tell them to join the Facebook group, okay? The Zoom is full. So please note that the most important consideration in somebody who has a fall is a history of previous fall. Now, that same patient, she's conscious and alert. Which underlying medical conditions will you inquire about? I think we've already dealt with this question. So let's move on. Okay, so you remember that when we're talking about the history, we said that there's some medications you want to also find out about. The medications which are usually implicated in fall, are number one, psychotropic medications. Number two, sedatives. Number three, antidepressants. Number four, antihypertensives. Which medications are implicated in fall most of the time? If you know some psychotropic like haloperidol, olanzapine, all those antipsychotic medications. Number two, the sedatives, benzodiazepines, like medications which can cause sedation, like even opioids. Okay, antidepressants like SSRIs, SNRIs, MAO inhibitors, and then antihypertensive medications, because why? They can drop the blood pressure. So these are medications which are usually implicated in a patient with fall. What about environmental factors? Because we also said that that is part of the history. Environmental factors that are responsible for fall. Number one, lightning in the room. The medical council wants you to know that. Lightning in the room. What about the floor covering? Is the floor covered well? Does it have any loose covering? What about the door threshold? So probably the person was getting out of the door and then the person skipped and then the person fell. And what about railings? Are there any railings that the patient can hold on to? What about furniture in the room? These are all things that you want to know on, the environmental history of a patient with falls. So we go back to the risk factors, because the objective used to talk about risk factors. So risk factor assessment. Past history of fall is the most important thing you want to know on history. Number two, does the patient have any lower extremity weakness? What is the age of the patient? As the patient ages, the risk of fall also increases. Number four, female sex. And then patients who have cognitive impairment, as well as patients who have, balance problems as well. They are also at risk of falls. And then drugs like we've talked about it, neuroleptics, benzodiazepines, antidepressants, and patients who have arthritis, especially arthritis of the knee, and then history of stroke, as well as orthostatic hypotension, patients who have dizziness and anemia. So these are all risk factors for falls in elderly people. Now, this is a very important point that I need you to make a note of. Which factors are associated with increased risk for falls with major injuries? So we've looked at factors which are risk factors for falls, but then how will I know that this patient may have a major injury? Number one, if the patient has a fall associated with syncope, that's one of them. Number two, if the patient has a history of previous fall with injury. So remember that previous fall is one of the most important risk factors. But then if the patient has had a previous fall and was injured, then that patient is at risk of developing a very severe injury with another fall. And then decreased executive function. So the patient cannot, do things like executive function, make phone calls, do accounts, all those things. Executive function.